Well, good morning. I'm Kevin Corbett. I'm the state's Secretary of Health and Mental Health and also the CEO of the Oklahoma Healthcare Authority. Today is an exciting day. It's actually a historic day. Today marks the beginning of an important change in how we deliver health care for over 1 million Oklahomans that are on SoonerCare benefits. It is also a day that we commit and we honor collectively our vision for all Oklahomans to be healthy and have access to health care services regardless of their ability to pay. This day is long overdue. Let me first thank the many people who have supported these efforts and have come together to celebrate our new Medicaid delivery system that we are referring to as SoonerSelect. For years, Oklahoma has ranked far too low among the rest of the country in healthcare outcomes for our citizens. In fact, it's been decades. We can no longer continue on this path. This is a pivotal time for healthcare in our state, and SoonerSelect is the significant opportunity to positively change lives for our fellow Oklahomans, and the time to change is certainly now. The development of this program has involved a great deal of collaboration, beginning with the vision created by Governor Stitt and the passion of the staff at the Oklahoma Healthcare Authority. And it has included health leaders from around the state. Several rural and urban hospitals have participated, federally qualified health clinics, physician practices, our university hospitals, as well as our board. Many of these leaders are here today, and thank you for your attendance. Also, members of the Oklahoma legislature, particularly Senator Greg McCourtney and Representative Marcus McIntyre, who led really a legislative process that resulted in an overwhelming support and approval for us to make this change to the new delivery system that benefits all involved. We will certainly continue to collaborate with these partners to prioritize health care services as well as access and achieve quality health outcomes for SoonerCare members, as we always have, including inviting Oklahoma providers to the table in a new capacity as a contracted health plan. Innovation is key to success, and to be successful, we need to be willing to try new ideas and willing to change paradigms. It is time to break the mold. We have intently studied states that have used this healthcare delivery system and successfully achieved outcomes, and we're certainly expecting the same for us. We have also consulted other state Medicaid agencies and healthcare providers and are using the lessons learned that they've learned to ensure a smooth transition and a successful launch. We will settle for nothing less than making this a life-enhancing and, in cases, life-changing and life-saving initiative for our SoonerCare members. We're also confident this transition in healthcare will be successful. It is a significant opportunity, and as Oklahomans, we know how to roll up our sleeves and get to work. I firmly believe that what is desired can be accomplished. I ask us all to keep this in mind as we move forward. Regardless of your profession, your work, or what you believe are the appropriate strategies, we all share the same goal. We want Oklahoma to be a safer and healthier place to live, and together we'll make that happen. Thank you again for coming today and your commitment to improving the lives of Oklahomans. And now I'd like to invite Governor Stitt to share his remarks. As he's making his way to the podium, let me offer my personal thanks to you, Governor, for your relentless of making Oklahoma a top 10 state. It is your passion and your leadership that has led us to this celebration today. Today we make history. Thank you.
How you doing, Nuttall? See you. Man, it's great to be here in Norman Regional, my hometown of Norman, Oklahoma. So it's just great to see all my friends here and come back down here this morning. You know, like Corbett said, this is really a fantastic day for the state of Oklahoma. As we're going to celebrate a new healthcare delivery system called SoonerSelect, and Kevin Corbett, our Secretary of Health, has done an amazing job, and I cannot let Oklahomans know how important he was and he is to getting this across the finish line, working with all the providers, bringing all of the different groups together to make this day possible. So Corbett, it could not be done without you, and I want to give him a big round of applause, everybody. You know, Oklahoma's new Medicaid delivery system, SoonerSelect, I believe will make a critical difference in the health outcomes for over 1 million Oklahomans. Think about that. 1 million Oklahomans are recipients of Medicaid in Oklahoma. As we talk about it all the time, I have a vision to make Oklahoma a top 10 state in everything that we do. We track all the different metrics, whether it's roads and bridges or tourism or the economy, visits to our state. Health is certainly at the top of the list that we track on a monthly basis and see where we are and compare our state to other states around us. And I think Oklahoma takes second place to no other state. If they can do it, we can do it. And so how do we get there? You know, for far too long, I believe our leaders, we've been a little bit complacent with mediocrity. And enough is enough. When Medicaid expansion was put into our Constitution in the summer of 2020, I knew we needed to reassess how we deliver health care in our state. That's why I called for this new system to make sure Oklahoma was getting the dollars from the federal government that we needed to provide the best care in the state of Oklahoma. In 2021, I asked the legislature to join me in the commitment to prioritize access and improve the way we provide health care in the state of Oklahoma. We need to focus on outcomes, not just paying invoices in our state. I was so glad to sign Senate Bill 1337 and Senate Bill 1396 this year. And I want to thank my partners in the legislature for getting that across the finish line. We would not be here without their support, their diligence. Representative McIntyre, thank you so much for your leadership and bringing the people together as well. And Senator McCourtney has done an amazing job. And there are the two people in the House, the Senate, that we look to for policy regarding health care. So I truly believe Oklahoma is the right place to raise a family, to start a business. We have everything that we need here in Oklahoma to be a top 10 state. And that starts with health care today. I'll never stop working to improve the quality of life and the quality of care in our great state. I appreciate everyone in the room who shares that passion, and I know you do in the healthcare profession, and I cannot thank you enough for everything you've done over the last couple years. I know you specifically, your industry has been on the forefront as we fought COVID and as we kept Oklahomans safe for the last couple years. So thank you again for being here today. And now I want to pass it off to Richie Splitt, the President and CEO of the Normal Regional Health Center. So Richie, please welcome him.
My apologies. So thank you, Governor Stitt, for your introduction. And it's an honor to have you and Corbett and our distinguished guests here today. What's that? Okay. Are we good? All right. So again, thank you. I really appreciate you all being here, and thank you for choosing Norman Regional to launch this new and innovative program on this historic day. As you described it, it truly is a historic day. And we are excited to be a part of this launch, that this program is sure to make a positive impact on the health outcomes of Oklahomans. And I know it's a goal of yours, Governor, to make Oklahoma a top 10 state. And it's a goal that I share, and all of our speakers today share in that goal. And again, it's an honor to be here to do this launch, and we believe this is one more important step toward achieving that goal. My name is Richie Splitt, and I am honored to serve as the leader of Norman Regional Health System and the more than 3,000 employees who we all call healers. Norman Regional serves people from across the state of Oklahoma, especially in the south central part of Oklahoma. And our health system includes 3 main facilities in Moore and Norman. It includes multiple physician clinics, as well as health and wellness care, digital virtual care, and an MSTAT ambulance service. As you've heard from the Secretary himself and from Governor Stitt, health care today is changing, and it is changing rapidly. Both in our state and across our country, we are seeing those changes. Happily, I can report that Norman Regional Health System is changing right along with healthcare in America. And we are doing that by joining to this model that we are talking about today, SoonerSelect, and the care delivery that's about to occur in the state of Oklahoma. Our changing involves physical expansion of our HealthPlex tower. We're adding a new patient bed tower, expanded outpatient services, a new state-of-the-art cancer center, and likewise, in about 120 days or so, we will be opening a brand new freestanding emergency department that includes services like primary care, specialty care, lab services, imaging services, physical medicine, and mammography. And finally, Norman Regional Hospital, the place we're standing in today, this very location will be transformed into what we're calling a health village. It will include a brand new adult behavioral health center located on this campus, and the City of Norman's Senior Wellness Center, and more to come as well. And why is that important today? It's important because the transformation of Norman Regional is a tangible example of what healthcare will look like in the future. Norman Regional Health System is modernizing the way that we deliver care, and these expansion projects, these new locations, digital virtual care is a reflection of those changes. It allows us to grow our community outreach and to further empower and inspire people to live healthier lives. Access to care is important to Norman Regional, and it's important to all Oklahomans. This new Medicaid delivery system that is called SoonerSelect will further increase access to care. SoonerSelect will effectively remove many of the barriers that have long impeded the delivery of continuous high-quality medical care to our most vulnerable citizens. During the pandemic, our doctors and nurses, they saw firsthand the consequences of delayed and interrupted care and treatment. As a result, we more clearly understand the importance of seeking medical attention early and receiving continuous medical care and for those chronic conditions that plague many of our residents. SoonerSelect is an advanced healthcare model that will remove many of the burdens that prevent people from seeking timely and ongoing care. It will ensure the state's most vulnerable citizens will have better access to preventative care and care coordination. SoonerSelect has been designed specifically to empower and inspire people to live healthier lives. To the Norman Regional physicians and healers who are in the room, I want to say thank you for your ongoing devotion to the patients that you serve. I believe this new Medicaid delivery system, SoonerSelect, will support our unending commitment to health and wellness. To Governor Stitt and to Secretary Corbett, I want to express my deep appreciation for your collaboration with Oklahoma providers and the state legislature to ensure that SoonerSelect fully considered the needs of those affected by a program of such great magnitude, importance, and possibility. I look forward to continuing our work together as we move to make Oklahoma a top 10 state for health outcomes. And next, I would like to introduce Carrie Slatton-Hodges, Commissioner for Mental Health and Substance Abuse.
Thank you. You know, one of the first things that Governor Stitt talked about when he took office was that it was incredibly important to move the needle on health outcomes in our state. As a state, we have had issues around high rates of obesity, high rates of heart disease, high rates of diabetes, high rates of cancer. And he has said over and over, enough is enough. I feel like that is so incredibly important that he has set the needle and the course for all of us to imagine the unimaginable. Now, sometimes I'm asked, why does Oklahoma have such high rates of mental illness and addiction? Because we do as a state. And I'm always, I always think, do people think that the brain is different than the body? Of course, if you have high rates of medical illness, you're going to have high rates of brain disease. And so one of the huge opportunities that we have with this move forward today is to ensure that regardless of where a person goes to receive care, that we are looking at that individual in a holistic way, that we are looking at how any illness they may be experiencing that we think of as physical is affecting their brain, and that we are looking at anything that we know is a brain illness and how that is affecting their body. There's a tremendous amount of research that shows us over and over that these are interconnected. And so as a state, we must improve our health outcomes. Our health outcomes are so important. They drive everything from our economy to our employment to whether or not people graduate high school, go on to college, graduate college. It affects each and everything that we do. So I'm very proud today that we are looking to be as innovative as possible, to weave together provider partnerships with nonprofit partnerships and government partnerships to ensure that we're taking a look at whether what we're doing is having the very best outcomes that it can. And if it is not, we're going to change that. My goal is that any time you walk into a health provider, whether that be your dentist, whether it be an emergency room, whether it be a medical provider, that they are asking you questions about your brain health as well. Because the earlier we can start to treat those issues, along with your physical care issues, the more productive, the better quality of life, and the better outcomes we're going to be able to see. And I think this is a huge opportunity for that. I am so grateful, as many have mentioned, but it is worth saying again, to Governor Stitt for setting our eyes on what we can be as a state, to Secretary Corbett for not giving up, although I saw a few days where he was a little weary. And for Marcus McIntyre, who has the importance of physical health of Oklahomans has been at the forefront of everything he has done since he stepped into his office. So thank you for that, Marcus. Representative McIntyre. So I'm just grateful. Today is a historic day in Oklahoma. The sky is the limit, and we're moving up from here. Next, I would like to introduce Mr. Jim Gephardt, who is the Community Director for Mercy Health Systems. Thank you.
Well, good morning. It's truly a pleasure to be here today, and as others have said, this is a very exciting day for those of us in healthcare. I do want to express my appreciation to the many people who have played a significant part in what has taken place here. First, I want to thank Senator Greg McCourtney, Representative Marcus McIntyre, Secretary Corbett, the Governor, Governor Stitt. Thank you so much for your work. The staff at the Healthcare Authority, they have labored hours and hours and hours in putting together different versions of this, and we're very grateful for that. I'm also grateful for hospitals, physicians, and patient advocates across our state who have worked together, who have cooperated in delivering what I think is going to be something that's transformational for our state. Improving healthcare is what we're all about. It's what most healthcare organizations focus on every single day. This allows us to do that at a higher level. First, a little bit about Mercy, and not here to talk about Mercy, but we're a not-for-profit health system across the state, actually across multiple states, and we have a deep legacy of serving our communities. In fact, this month, Mercy is celebrating and beginning a year-long celebration of our 75th anniversary in the state of Oklahoma, so 75 years of service. So we're not new to the table here, and we've been trying to accomplish these things for a long time. The Sisters of Mercy came to Oklahoma to serve the underserved, many of the same people that we're talking about today. At Mercy, we call our organization a ministry because we believe we're called to serve everyone. The passage of meaningful Medicaid reform will help us provide health care access to many more who need it. From our perspective, the very heart of this legislation is simply to improve the health care of Oklahomans. This value-based model creates a process that encourages preventive care with a focus on care coordination for patients putting their patient and their healthcare provider at the center of the plan. That's where the focus should be. Many more Oklahomans now have access to primary preventive care for the first time as uninsured individuals. So think about this. As Governor Stitt said, 1 million Oklahomans now have access to health care, but now they have access to the very best health care. It means more patients have access to consistent health care providers to address their chronic health conditions like high blood pressure, diabetes, or asthma. These same providers will follow them over days, months, and years with a focus on improving their health and tracking their results, making tweaks to their diet, to their medication along the way to make sure that we're caring for them at the highest level possible. Most importantly, we're preventing them from having to go to emergency rooms and have higher acute services, and that's really important for the state. It drives higher quality. It also lowers our cost as a state. They'll have access to new services as well, like nurse navigators who will be available to answer questions and provide a care plan specifically for them. Resources like a diabetes educator to help them understand their condition and exactly how they can manage that. You know, we're dreaming big here today, but long term, Mercy hopes to be able to increase access to healthy food and nutritional support for this population and help with transportation when that's a barrier to care. Eliminating all barriers to care so that they receive the appropriate level of care. It will simply mean better care for some of our most vulnerable patients, as Richie said. It can also mean fewer ER visits, which in turn reduces cost. It can mean better care for our mothers, bringing new life into the world, as well as more comprehensive care for our elderly. I see representatives from other hospitals and provider networks in our healthcare community here today. I think we all know this won't be easy, but I know that we can do this. It's already encouraged conversations around the state about how we work together and how we coordinate care. We also know part of the success of this program will depend on the patient and their level of engagement in their care. We will create new, innovative ways to reach these patients and help them navigate this kind of care for the first time. A new patient-provider partnership that might not exist today. We stand ready to roll up our sleeves as healthcare organizations and get to work to make this program a success and have a true impact on the lives of Oklahoman. We're grateful for the opportunity to serve Oklahomans and to serve Oklahoma communities. I'd like to invite Secretary Corbett back to the stage at this point. Thank you.
I think we have some time for some questions. I'll ask the speakers to maybe join me here at the podium to be able to address any questions that are raised. Yes. Yeah, it's a process, as we've talked about before. If you look at the legislation, our intent, with all practical purposes, is try to have this launched by October of '23. There's a lot of steps that have to go involved in that, including our federal partner, that being CMS, to go through the approval process. So we're going to work as swiftly as we can, but really thoughtfully to make sure that this is a successful launch. Yeah, for states today that use a similar care coordination model, there's about 40 of them, if you will. But quite frankly, one that we were most intrigued about was North Carolina, because that is a new program that they launched where it really has providers at the table. They have something called provider-led organizations that now run health plans very similar to other traditional health plans. And we're looking forward to conducting ourselves with the possibility of having those kind of providers at the table with us.
I have not spoken with Gino, and Gino has done a good job, and wish him the best. And I got notified of his resignation, I think yesterday or the day before.
Governor Stitt, last year there was some back and forth over the state, concerns about the state having full, or I don't know if that's.
Who's giving you your questions?
I came up with them myself, sir. Yes, so there was some concern over the providers only covering the most affordable treatments. Does the state have a mechanism to kind of safeguard that in this plan?
I'll let Corbett answer that one.
Yeah, I would say if you were to look at the benefit package that we currently provide for our SoonerCare members, it's very similar to other commercial plans. It's pretty robust. We think that we'll have the opportunity to maybe even enhance that through this process. We're looking for our partners also to bring some very innovative and value-added programs to the table as we start to this partnership.
I think there's some concerns from the general public who maybe don't understand what's happening very well, that, you know, if they need a costly medical procedure and they're on Medicaid, that under managed care, that costly medical procedure might get denied. Can you sort of respond to that and explain those fears?
Yes, I can. What I would say first and foremost is there's been some discussions with using words like privatization and outsourcing. The fact is that the Oklahoma Healthcare Authority is accountable and will remain accountable, which means that we will set the criteria and the expectations that all of our partners will follow. We look to utilize partners to extend the capabilities that we currently have at the Healthcare Authority. We will be looking at authorization activities, timeliness of those things, denial rates, but those are all under our control. We are not ceding control to any of our partners. We're just using the opportunity to use the expertise that we currently do not have at the Healthcare Authority through these partners.
Do you see the same companies that bid on the contract last time and were awarded the SoonerSelect contract? Do you see them getting them again this time or bidding again this time?
We will go through a competitive bid process. I am hopeful that we will have a lot to choose from, particularly on the provider-led organizations. Again, in the legislation, it was very clear that we will give preference to provider-led organizations, and we hope that we will have a number to choose from. We're not going to be able to select them all because we're not going to be able to need that many partners, but we're hopeful that we'll have lots of choices to choose from.
A little bit off topic, you mentioned outcomes, health outcomes. I think part of that is people that care for their patients. How would you assess the current state of the nursing staffing or shortages in the state?
Well, as you know, I mean, it's been under siege, and everybody in this room would probably acknowledge that. There is actions being taken right now through the what I'll call the ARPA process in terms of making investments in healthcare workforce. It's something that was a priority for the governor and the health cabinet, is to see that those investments get made. We've had some that have been awarded so far. We've got more to do, and we think that's very important, is to have a network of providers. Let's face it, the Healthcare Authority does not provide healthcare. We facilitate the healthcare. We look to our providers, which we're very fortunate. We have 70,000 plus providers that serve the million members that we have. But we're going to need to make sure that they are adequate in terms of the network across the states.
I guess for the two healthcare executives, Secretary Corbett mentioned the provider-led preference present in the legislation. Do you see Mercy and Norman becoming some of those provider-led providers under the program?
So we are evaluating the best way for Mercy to be able to care for the patients in our state. And so it could be in a partnership with someone like Norman Regional. It could be in partnership with other healthcare providers, or it could be with one of the payers that Secretary Corbett mentioned earlier. So we're evaluating our options.
I would reiterate what Jim said. I mentioned in my comments that healthcare is changing, and so we're positioned well to plug in, to be supportive, to be in the lead, to do whatever is necessary in order for us to execute this plan, to bring it to fruition, and to really address those health outcomes. So alone, Norman Regional can't do it alone, but we stand ready to be a partner in that process.
And the governor, you just big news with the Mission SOS. Talk more about that. It's off topic, but it is news today.
Yeah, executive order that we signed, you know, safety in our schools, I think that's on top of mind for Oklahomans and for Americans. And so I got with my law enforcement, and we rolled out a 6-point plan, and it was about reassessing and assessing, doing a safety assessment for our schools across the state of Oklahoma, and then new training for our police officers, behavioral training for our teachers. We're going to put some technology in the different schools. So we're excited about the plan, and wanted to make sure that in Oklahoma that all of our law enforcement had the proper up-to-date training, the equipment that they need, so we can keep our communities as safe as possible. So that was kind of the effort, and the reason I got with the law enforcement, and then on the ARPA process, we want to invest some dollars in our schools and our law enforcement across the state as well. Well, we're watching those and monitoring those. I think the red flag laws are what people are most concerned about, and we want to make sure that there's due process in the state of Oklahoma. So that's what I've said publicly, that we have to have a due process. You don't put your Constitution in the attic on a whim or because someone in Washington D.C. says that they want to take away a right. So we believe in the Second Amendment in Oklahoma. But at the same time, we want to make sure that all of our communities are safe.
Last question. Kevin Stitt, I have a question about Jim Marco. Can you tell me, has he resigned from the healthcare authority board and so on?
Yeah, I'll let Corbett answer that. Did he turn his resignation?
He did, yes. We were informed that he was resigning, and you can get a copy of his resignation letter, but it really is about time commitment. He's got other time commitments, and he applauds what we're doing with regards to healthcare reform from a Medicaid standpoint, but he didn't simply have the time to be part of the transition and the transformation process.